let me warmly welcome Anna Álvarez Soto, who's MD and a Doctor of Medicine, and also undertaken management studies in health systems. She's senior manager at the Bellvitge, I'm not sure how I say that correctly or not, but I hope I have, University Hospital in Barcelona, and has been the Director of Processes since 2017. This Director of Processes was created with the purpose of changing the culture of the organization, orientating it towards continuous improvement with the participation of professionals and patients. The core methodology they've used in transformation has been lean. Anna will explain the main obstacles encountered in 5 years of travel through lean management, the little tricks that have made the journey easier, and what new challenges they now face. So please warmly welcome Anna. Anna, over to you. I will just put the slides up and then we will make a start. Over to you, Anna. Oh, you just on mute, Anna.
Can you hear me now?
Yes, we can. Yeah.
Okay. First of all, thank you for thinking about my little or humble experience in Lean. We've been doing this trip for 5 years right now, and I think that we've done a big change of culture that it's really important for any methodology that you want to introduce in a hospital or in an organization, and now I'm trying to explain a little bit of our hospital. Our hospital is a university hospital, a big one, a third level of a high complexity hospital. And next, yeah. And we have a proximity population of 200,000 people, more or less, two cities, Hospitalet and El Prat de Llobregat, and at the south of Barcelona. But we are the tertiary reference of 2 million people of the south of Catalonia, almost half of Catalonia. So we are a big hospital and a complex hospital. Next. We do what we do with this structure, hospitality beds, ICU beds, critical post-operative beds, critical cardiologic beds. We have 33 operating theaters. We are a mainly surgical hospital, and we have a lot of high technology equipment. So it's a really complex city. We call it like a city. Next. We have some fields of excellence. These ones are the top 5: health department, neuroscience department, oncological diagnosis and surgical attendance, transplants, and robotic surgery. But we also have other fields of excellence that we show here in the right side of the slide. Next. And this is a big or small city, about 5,000 people working together in this big building. So next. In 2016, when we arrived to the manager team, to the manager board, we were the worst hospital in surgical waiting list in Catalonia, and we had poor quality results that we can show in this slide. Quality as mortality or readmissions, and some KPIs that were not okay. We have had, or they have had, because I came from other hospital, 3 different manager teams in 1.5 years, with everything that means that it's difficult to start and finish projects with so many changes. We are a very hierarchical organization because our public health system is really hierarchical right now, and we were getting out of a deep economical crisis that was really hard in our hospital. But we also have had a mood in the people working there of accepticism. They were doubting about everything. They doubt that we could fix anything, and victimization, because they thought that they can't do anything to change. They couldn't do anything to change things like they were. So the next slide is, I'm sorry, but it's a PDF, but it's not, you cannot see it, the whole slide. But here we wanted to reflect that we wanted to make a change. We wanted to improve. We wanted to connect with people that were really disappointed with everything. And we wanted to do it with a methodology that we knew before, that was like lean management, because it's about cooperation, it's about empowerment with to the professionals, and it's about respect. So it's the way we wanted to work with them and to manage the hospital. First, we started with some consultancy services, and this had pros and it has cons too. Pros, they were evidence that they started to generating the culture in process management. They started to make some training to the professionals and prepare the way for change. But on the other hand, they didn't want the managers to be in the groups, not only in the groups, but also to make updates. So we were a little bit, as a manager, as a part of the manager team, we were a little bit discomfortable with that, because we didn't had the I don't know how to say, las riendas. We couldn't manage where to go. So it was a little bit uncomfortable, and we were worried about the sustainability.
Sustainability, that's great.
Yeah, sustainability. Because when they leave, and you have to go on with that, and maybe it's not so easy with people that are a little bit disappointed with everything. So next, we started with our own team. The first team was me, myself, and I, and then we have some other. I have other people that helps me, and that are my colleagues right now. And I think that this model has also cons, but the pros are really heavy. We promote sustainability, and because we are always there, so it's easier to maintain the results and the culture. We started to involve the higher directors, so people also believed that this was a strategic thing for us, and we have a global vision of what happens in the hospital, not only in one part of the hospital. It's difficult sometimes to be to not to get too much involved, or not to leave the meetings with more work than you have when you enter in them, because I know that we are a little bit paternalist, because we want to help them and not to put more work on their backs. But sometimes I think that we should leave and let them work alone. So we are in that equilibrium, trying to keep the things leveled. But it's for us it's a good model, and it's working. Next. We started in 4 areas, surgical area, that was our first project, hospitalization floors, emergency room, and endoscopy department. But then with the pass of the time, of the years, and even with coronavirus, with COVID pandemia, we've been growing in people, and also in projects. So now we are almost 30 projects at the same time. Well, small ones with small teams, but we have right now maybe 300, 400 people involved in projects right now. So I think it's a good change in culture. Next, it is also a dynamic slide, but now it's a PDF and I can't change it. But now we are here in all those areas that it's almost every part of the hospital. One of the top projects we are in it right now, it's discharge before 12 p.m. in several services without making an average stay longer than we have now. We have some 5S projects. We have been working in emergency room with Hoshin Kanri right now, in pharmacy, in human resources, in lean office, in logistics. That it's a big amount of things that we have to manage and sometimes it's really difficult in radiology, laboratory, and all those things, all those places that you see in the slide, with a lot of projects. Next. Now I don't see anything. It's an Ketan.
You're on
Ketan, we
mute,
are
Ketan.
seeing a
Okay.
blank.
I wasn't blank. Now, we have also some clinical processes that are focused in some kind of illness, like or process, but really focused in a clinical way or pathway, kidney transplantation, ictus-code, but also with organizational processes. We are designing some parts of the hospital working before the process we want to have. Some innovative process with partners, with the industry partners. And also we have some small projects with external consultancy that are financed by some laboratories or some partners that we have. Next. This is our first 3 years. We started in 2017, and in the next years we had our lean days, one in the 18th, 19th, and the one of 2020 that has been postponed to 2021. Next, that has been 3 months ago, 2-3 months ago. That it was a really exciting meeting, because we always want to see other people and to share what we have been doing for the last 2 years in a difficult period of time. So next, as you can see, we work with A3. It's our main tool in Lean. And next, and I can show you some results. Next, the sterilization project, it was important for us because we had 3 different surgical areas with three sterilization centers. So we had to put together all the surgical rooms in a floor that are the new surgical rooms that we have now, but also the sterilization units. So to be more efficient and to be more productive, because we were growing in a number of surgical procedures. So we have to sterilize and prepare all the things the doctors need. So we had a big amount of work here, but it was really effective, and we grow more or less 46% of productivity and 21% of efficiency. And we are cheaper than we were before. Next. Neurology is a place where we started doing lean in hospitalization rooms, and it's our main defender, because our principal defender, because they really believe in the methodology, and they always want to do more and more. So this is the first thing we did, that it was to short the average stay and to improve the discharge before the 12 p.m. And as you can see in the slide, we had the worst percentage of discharge in 2018, and now we have almost 30%. We started at 4, and now you are in 30%, and the average of stay has been shortened in 4 days. So it's a really good one, a really successful project, with a lot of effort, but with a lot of good attitude. So it's our I don't know how to say in English, but our left eye. So we work together really well. Next. Nephrology also is involved in this project, in the search before 12 p.m. and they have been improving, and they are improving right now. So it's like just a little bit of what we are doing, but it's really nice to see that it works. Next. Our process, that it begins with some boards like this that you have at the left side, has become a platform, a digital program that now help us to manage the admissions, the unit of the admissions unit, and to help us to manage the beds. How, like if it was a hotel, that you need to know which bed or which room is empty or it's full, and which patient of emergency room has to go to that room or to that bed. So you need to know if that bed is empty and if it's clean and everything. So it has been a big change to do it right like this with our informatics system, and not with boards and small cards. So we've been digitalizing because of the process too. Next. And the digestive endoscopy unit, we have also had a lot of work and a lot of effort, but with really good results. We spent 1 hour and a half with preparing patients for one interventionist endoscopy, and they have to pass for a room, then to another recovery place, and then to the box where the surgical room where the procedure is done. And now they are going straight ahead to the box. So we are not doing that preparation that really didn't give any added value, and we'll take it off. So that it was a really time saving. And then we had to a lot of cancellations and reprogramming because of bad manage of the schedules of the doctors. And now we have been improving. So we had 73% cancellations, and now we have 33%. It's a lot, but it's quite less than before. And all those doing more activity than before, because at the beginning we were attending more or less 35 patients per day, and now we are 50 patients per day. Next. Now in global, what are the benefits? The benefits are for patients. We think that they are the best, the first one we have to look for. So they are waiting less. They have less waiting time spent waiting, just waiting with no added value. They have less tests. They don't have to be analyzed for things that are not necessary. We worked in a project that eliminate all the analytics before the surgical procedure, that nobody knew why they were being tested, because always have been like this, and we take it off and nobody is missing it, so it's not necessary, and it's a safer assistance. I think that we are improving in safety patient. So next, for professionals, they had the feeling, and it's a fact, that they don't have so many waste, that the work is leveled, so they don't feel that one is working a lot and the other ones are not working so much. It's been leveled. They now think that they can fix things, that they can improve what they are doing, and they know that they can design how to work and design how to even the places to work where they will work. So it's a big difference from the beginning of that journey, 5-year journey. And next, the benefits for organization. Well, if you have been doing lean management or the methodology or the philosophy, it's that organizations want to be more efficient. For us, it's a good thing to do things better, because we will have a better reputation. And for us, it's a good thing. It's an important thing. We want to share our strategic view that we have to get involved in continuous improvement without ending. And we can say that we are more reliable for the national health system, for our national health system. We have been working a lot to achieve that aim. That I'm sorry, I don't know what have I done. I'm sorry, I'm not seeing you. Oh, I'm sorry. I don't know what have I. I'm sorry. Now, and it's a good thing for us and an important thing for us to be reliable for the system. Next, we did a survey some 3 years ago, more or less, with professionals that are involved or were involved in that moment in our lean processes, and that survey made us happy because the results were really, really good. Next, they all were satisfied or more than satisfied, and they were people who had been working there for more than 20 years in the hospital. So they weren't young people with a lot of illusion and not really high or big experience. They were people who had been working there for a lot of years, and then they in that moment they believed that they are listened, and they have the opportunity to change things. So next, if you can see, these are some of the things they say or they said in that survey, that the methodology was enriching, innovative, that it worth the effort. It was a big effort, but it worth it. Satisfactory, intense, positive, illusional, surprising. Someone said, "Let's see if it works," and it's normal. And one thing that I like most is that it's collaborative. We want everybody to collaborate and to make them believe that the project is theirs, and not only of the direction board. So we have had difficulties. We have difficulties in some groups when we enter for the first time. We even note some skepticism. That sentence that it's the second line, it has always been done like this. It's a must too, even in right now, but not as much as before. There is a little bit of resistance considering it as an intrusion, because you are a doctor, but you are a doctor of other specialty, or a nurse. That it's one of my colleagues is a nurse, and two of my colleagues are engineers. So you are coming my home, my place of work, to tell me how to work, and it's not like that. But sometimes they can feel that, and sustainability. That it's right now it's a worry for us, but not as much as before. But we are really interested in that the results keep maintained in time. So some helpful tips that work for us, and maybe it's a good advice for you. The election of the team, the lean team, the people who works in the process unit. We have people from inside, that we are doctors and nurses that we have been studying and learning and training about lean, but also engineers with knowledge of lean, but with no knowledge in medicine or in hospitals, but they have been learning a lot. But they have also a new view, a fresh view of what we have been doing for a lot of years. So it's a good thing to mix people from in and from out. And also the election of the process group, the process that the group that will work each project. Everybody that is involved in the process has to be involved or represented in the group. And it's the way that no one that we won't miss any opinion or any important thing in the design of the new process. Next. Other helpful tips. The manager team elects the area to improve or to work, but the process group, the people who is working there, is the one who chooses the process to start to improve, because we think that they have to believe that it's their own project, and they have to decide. Also, if they decide to fix or to improve or to make a countermeasure, these are the ones that have to be implemented, not the ones that any other person out of the group decides. They have to. We will implement the things that the group says, and that's why they believe that they are important for the manager team. And it's a fact, they are really important for the manager team. We cannot know every piece of the hospital and every piece of the things we do in the hospital, so we need to rely on them and to give their opinion as the right one. So another helpful tip is implication from the staff, from the front line to the highest manager team or highest manager board. If you don't have the implication of the managers, it's not possible to make real and sustainable changes. It's my opinion, but I've been sharing this opinion or these thoughts with other colleagues, and we all agree with that. Next. What are our next challenges? So implement monitoring. We are implementing kata panels, kata boards, and also we are involved in a Hoshin Kanri of all the hospital, but also from different services of different areas. And this Hoshin is going to help us to align strategy. But also we want to involve patients. We have been involving some patients in some projects because we think that in the point of view, is really, really important. And we are not always thinking about involving them in our way of work. Sometimes we are shy, or we are not comfortable if a patient is listening what we say about the processes, or what we the things that we know that are not good or are not okay, to accept this in front of a patient. Sometimes it's difficult, but now we are doing that, and it's a really enriching experience. And we want to be recognized as a lean organization in the national, in the Spanish or Catalan health system, but also outside. And that's why we want to spread our humble knowledge and results, but because I think that we need a community to share things and share experiences. And next, this is the picture, the photo of my dream team, the better than the usual dream team. They are from the left, they are Francisco, Fran, Rosa, I'm in the middle. The next one is Jose, and the tallest one is Jerónimo, like the Indian warrior. And they are my left, my right hand, my head, my toes, everything, because without them, anything of this could be possible. So that's it. And I had a video, but I don't know if Ketan has received it and can share it.
could I ask anybody who has a question to put it on chat so that we can ask Anna? And let me start off with a question I have, which is very much about one of the slides you showed was about the satisfaction of the staff. And to me, if the staff are not satisfied, even if the process is lean and very efficient, that tells you it's not going to be sustained because it's kind of been forced in, and made to succeed for a short time. So I wanted to understand how much effort you put in to make sure, with your team did put in to make sure that whatever was agreed was something satisfactory for the staff.
What effort do we have to do to assure that?
Yeah, whatever was agreed, whatever the process improvements you made, you facilitated, and I know you had staff involvement, but how did you make sure that staff are really bought in and that they're not just saying it in words, but they really meant it? Because that would then come out in the staff satisfaction survey, right?
Well, we choose the team because of, we want to be successful. So we have to choose people who really shows the willing of change and the willing of improve things. So we know them for years, and we know that they will work like a team, and they will help everybody to succeed. But also sometimes we have some people that it's not really involved or really implicated or happy with that. But at the end, the mood of the group is changing them. So at the end, we have sometimes a person in a group that it's the one that says, I don't believe that, it won't work, it's not okay. And the enthusiasm and the team building makes that people, that person sometimes becomes the leader of the team, or the one that makes the change. So for it's important that we know them and they know us for a long time, and we have been proving that we want to make them happier. So now they believe us, and now they come to us to ask, when will you come to our place, to our home? So that's so great. It's great for us. It's really amazing.
I really like that. There's a demand for your work, for your services, because they know life is going to be actually be easier for them as much as a patient.
We always say, when we start, we always say, our center, our principal aim is to improve things for patients, but that's our day work. So we always work with that objective. Now we are here to improve your work, to improve your life. So if you save time in anything you do, that time you can have it for whatever you want, or for doing something else for the patient that is nice to you, to talk more to patients, to sometimes they think, and it's a fact, that they don't have enough time for patient. So now we want to give them more time for patient. So it's a good thing too.
Thank you, Anna. That's very clear. Katerina, did you have a question? If you want to unmute and ask your question, that'd be great. And then I think, Ranmo, you have a question after that. Before you ask your question, Katerina, anybody else who has a question, just please put it on the chat. Off you go, Katerina.
First of all, thank you so much, Anna, as well, for sharing the insights. And of course, I'm here as well because I have some already specific ideas or questions, and that's especially in regards of the way of working in a hospital, because most people are working as well in shifts. How did the project teams arrange themselves to handle as well when part of the project team is working in shifts?
To go to the meetings and to get involved in the projects. Well, we have to make lots of meetings, but short meetings. So we have one hour each 2 weeks, more or less. We can't do long meetings because we don't have enough people to do their job when they are in the meeting. So we start with 4-hour workshop, and these hours are paid, or they are substitute. They have a substitute. But then for the meetings, the periodic meetings, we are just 1 hour each 2 weeks. So every 14 years we meet 1 hour, and that hour the rest of the team has to make a little effort to do their jobs. Sometimes if one is in the evening shift and the meeting is in the morning, they come and they are not asking for the money or for the hours, or they are involved and they want to collaborate with their time too.
Cool. But that's as well then, when you say you have a fantastic team, that means as well the fantastic team is as well within the whole hospital. So that's incredible.
Yes.
Really impressive. Thank you so much for sharing.
Thank you.
Thank you, Katerina. Okay, Randall, I know you had a question, and then we will ask anybody else if they have questions as well.
Yes, Ketan, I have a question, Anna, right? Anna, you told how you started off with 4 projects initially, and I saw the last year you have 28 projects, right? So that means there is a lot of small projects, medium scale and large projects as well, right? Now, what I have seen is sometimes we do a change, right? And then we move out from that area and then it's business as usual. And there are occasions where sometimes some of these changes are not carried forward or not continued, right? In sense, you do a change, but once after some time, it might revert back to the previous situation or into a worse situation, right? Have you come across this kind of a situation? How did you manage that to make? How do you manage to make sure that things don't revert back?
Well, at the beginning, we had that fear because we saw that, for example, with the discharge before 12 p.m. in neurology, we passed from 4% to 15%, and then go back to 10%. And that's when we started to learn and to study about kata, Toyota kata, and all those, not daily, because it's difficult for us to make a 5-minute meeting, but because there are some KPIs that we don't have every day. So we have to wait 1 week, 2 weeks to have the KPIs and to have the numbers, the results, to see if we are going okay or we are going not so okay. So we started to make kata with them, and not only we had sustained it, but we have also improved a lot. So now we are from 4 till 30. So it's a big success for us. It's a little big thing in the whole of the hospital, but the neurology service, the neurologists now are really lean believers, and you should listen to the head of the department. It's our best marketing leader. So because he talks really good things of the methodology. But we have some projects that have been not successful, and it's a fact. In emergency room, we started with 3 little projects, 3 little groups, but we hadn't the implication of the head of the department. He didn't help us, and it was really difficult. When we started to change things and we were starting to improve, and then came the COVID pandemic, and everything faded away, and we haven't start again the same way. Now we have changed the head of the department, not because of this, because of other things. And he is a lean believer because he has been working with lean in Medicine Sans Frontières in a ONG. So now we are starting from the top. Now we are working in the Hoshin Kanri, and now we are deciding in which problems are we going to put the focus on. So I think that when something is not working, you have to change the strategy. If you can go straight ahead, make a round, but you have to go. You don't have to surrender. So you have to change the strategy, or tell them, what do you want to do? And if it's really hard and they don't want to change, and we have so much work any other place in the hospital that it's not a big problem right now.
That's
Thank you, Anna.
yeah. Thank you, Ramo, for asking a question. I was just going to summarize. It's you really put it really well that when you roll this out, when you roll out lean transformation, you're going to get obstacles. And if you get no obstacles, then really you haven't taken on a very big challenge. You know, you're doing something very tiny, very small. And the trick is how you, as you said, Anna, go around the obstacles or confront the obstacles, but to keep going in the right direction. So I really like that. Thank you. Any other questions from anybody else? We have time for one or two more. Just unmute and ask your question, or you can put it on chat. Okay, no other questions? And I have another one for you, which is, in a hospital, I can imagine the clinicians are experts in specific areas, right? Neurology, nephrology, and so on. And also maybe some of the support staff and so on. How did that cross-pollination occur, you know, between very different processes, maybe very different operational processes as well, because that can be very powerful. And I'm just wondering how you allowed that to occur, that cross-pollination.
In this project in concrete, the one of this church, we have been sharing the results of other teams to the next teams we want to work with. So we show them that.
Oh, sorry, there's some interference. I don't know who it is. Definitely not me. Okay, let me just mute Shan. Okay, carry on, Anna.
We use different ways to spread the word. We have lean days, so everybody can see in the hospital what the other teams have been doing. When we start a process that has been done in another place of the hospital, we share the results, and we make that someone of the previous team came to that to explain the experience, and it's enough for them to believe that they can change and they can improve. I think that now, 5 years later, or 5 years later, after the beginning of the journey, we have we are reliable to them. If we say that we can improve, that we can do things different and easier for them, they believe in us. So right now it's not a problem to start with a new project.
I really like that, Anna. What's happened here is that because you won people over and the results are plain, you just have to explain the experience. In a lot of organizations, they're forced to transplant people. So you take A and make them work in department B, and B work in department C. You try and transplant the culture and behavior. But it seems, because you approached it in a way where the faith has been built very quickly, relatively quickly, then you don't need to do those strong things. You can just use the experience and sharing days, which I think is really wonderful. because the buy-in is there, the faith is there.
And the fact is that as we involve everybody in the groups, because if we are working in neurology floor, but we need the opinion and the complicity of radiologists, we have them in the team too. So when they see how it works, they want that we go to radiology too and help them to work better. So it's a big hospital, but a little town. So everybody knows everybody, and it's easy to spread the results and the philosophy.
I really like that, what you just spoke about, the village mentality, because I think that's wonderful, because it means everyone is sharing, everyone is learning from each other, and the conversations are of good quality. So thank you, Anna. Anybody else with any more questions before we wrap up? No? Okay. All right, then let me hand over to Ranmo. Ranmo, if you could do the vote of thanks, that would be fantastic.
Thanks, Ketan. And it was a really interesting talk. And Anna, thank you for sharing your experience and your journey, right? And it was nice to hear how you started with 4 projects and went up to 28 per year, and how you have 300 to 400 people now involved in these continuous improvement projects. So that's a fantastic story to hear. And I was impressed by how the change has also been managed, and you finished with the village mentality and how you share success. So it was a great experience for us as well, to go through the slides and understand what you have created. And while I congratulate you on your success, I also thank you for sharing with all of us, right? And special thanks to Ketan also for putting in a lot of effort to bring in everyone who is here. And once again, to everyone who is participating for the event, thank you very much for joining. Stay safe, and thank you very much.